So, right guys, hi, my name is Mick of the Leeds Listening Room. Today I'm interviewing John Hindley, who works for Public Health England. People hear about public health, but they're not sure what they do, so I asked John to come in and give us a brief rundown of what public health do, behind the scenes that we never see. That's okay? Good afternoon, John. How are you doing?
I'm okay. Thank you. Thanks for inviting me. My name's John Hindley. I work for Leeds City Council Public Health, and I've just been invited in just to talk a little bit about the work of public health with partners, and obviously in the middle of this terrible pandemic. So one of the three things that public health do is about protection. So in the middle of a pandemic, our health protection teams are out and about. And when the coronavirus first started, we had a lot of mobile testing buses. We had one in New Wortley, not so far from here. And the idea was to bring testing to people who were in a deprived neighbourhood. Armley in New Wortley is a fantastic place to live and bring in families, but it's not without its problems and its issues, its deprivation. Consequently, those sections of society suffer most during the pandemic. So one of the things public health do is that we have mobile testing centres as well as pop-up testing centres and static testing centres, just to make sure populations can get tested, feel safe. Pop-up testing centres, there's no need to book, so you can just come down.
Just turn up.
Just turn up. So it's to encourage more people to get tested. Yeah. And as we've moved through the pandemic and obviously the tragic loss of life, we're onto the vaccination stage now. And we do the same kind of thing, so we encourage vaccination for all of the priority groups, starting with the oldest, working down to the most vulnerable. That's been a great success in Leeds. Leeds has been ahead of the curve, and also the UK's been very successful in its vaccination programme. So it's meant we've moved down pretty quickly to the over 50s, we're now on the over 45s, and it just helps to make society safer, and it helps us to gradually come out of the lockdown and we move closer to some kind of a road to recovery and resilience.
Yeah, that is important. It's resilience is what happens after, isn't it? That we need to be looking at as well. You know.
Yeah, absolutely. So the second thing public health do is prevention. So we know that the people who are the poorest have suffered the most during the pandemic, and also minority ethnic communities, communities of special interest that haven't had equal access to healthcare, sort of older and more vulnerable citizens. So what we try and do is we encourage healthy behaviours, because we know the healthier you are, the less likely you are to suffer some of the more severe effects of COVID-19. So that includes weight management, smoking cessation, eating nutritious food, and also your mental and emotional health, staying connected, which is one of the things Army Helping Hands does so well. It helps people to stay together. People that are lonely or socially isolated tend to suffer more during the pandemic and not always sure where they can access services. To do with testing, vaccination, and then if they have long COVID, so they're suffering from some of the conditions associated with COVID, that last or are chronic or last for a long time, they can access certain services and resources. Army Helping Hands being an excellent resource to help them recover and make them become stronger.
So you mentioned things like smoking cessation and healthy eating. Public health, do they put guidelines out about these sort of things?
Yes, that's right.
How will you access them then?
So there's the Public Health Resource Centre in Leeds, which you can find just by Googling, and there's a whole host of resources there which you can access virtually. So you can do this through services such as Active Leeds, you've got some online exercise sessions, for every ability, so from gentle exercise to more strenuous activity. Also, there are some self-help guides, there's some links to mental and emotional health websites which will help people manage anxiety and mood, because obviously people have been very anxious, locked up, there's been high levels of depression and low mood and just general anxiety of being worried about COVID-19. So all of these resources are available. And also, one of the other things that public health, the Leeds City Council does, is that we commission local services like Better Together and social prescription from the Commissioning Group. So these are services which help find people, outreach services that find people that are connected to organisations like Army Helping Hands or general primary care services.
But what sort of relationship do you have with doctor surgeries then? Do you deal with them?
Yes, we do. Yeah, that's a great question. So in recent years, we've seen the advent of the ascendancy of local care partnerships. So basically, this is a multidisciplinary team coming together to help people with the poorest health and to help them get better the quickest. So in the past, you might have been a local resident, you might have had a social worker, you might have had a physiotherapist, you might have had an occupational therapist, and you might have had to repeat your story or what's happened to you again and again and again. You're familiar with this Harmony Helping Hands. So the idea is to bring teams together to share case notes, resources, so that we could do more but do it locally. So an example of that would be rather than shipping off somebody to hospital, but we could do some tests and scans at a local surgery to make it more convenient. So primary care networks, which is a collection of local practices and surgeries, and local care partnerships, which is a collection of partners, a multidisciplinary team, come together and they look at person-centred health. So they're looking at the individual and pooling resources and stopping duplication. So stopping the same kind of intervention being done again and again to a person. I suppose most importantly is that we're looking at assets. So we're looking about what the person can do rather than the deficit, what's wrong with it. So again, like Army Helping Hands, we're looking at the positive side. What do they want to do? How do they want to manage their care? Do they want to go to a luncheon group at Army Helping Hands or New Wortley? Do they want to do a stop smoking through our One You service? Would they like to form their own residence group? So all of this revolves around the local practices, doctors, surgeries, clinics, and health centres in the area.
We keep you busy, don't we?
Yes.
Can I say? I mean, I've heard of public health everybody else, and and you're saying public health benefit. What is the sort of normal, typical day then, for someone in public health?
Well, I suppose the answer to that, I'm going to say there's no typical day. But I mean, recently during the pandemic, we've been helping to manage and organise the outreach team with our fantastic third sector partners. So we've been at testing centres, helping people, getting leaflets out, getting messages out, telling people that there's a testing bus or centre or pop up at the bottom of their streets. And then the other thing we'll be doing is that we'll be communicating information to residents, councillors, elected members, MPs, partners, workers, clinicians about best practice, how to access the vaccine, to help myth bust and just give facts around vaccines, to help people understand how best to cope with COVID-19, and most importantly, the services from the council and from third sector partners and neighbourhood networks like Army Helping Hands, the services that they can access. So that's food banks, money worries, managing anxiety, quick access to doctor's surgery, perhaps a social prescriber to help them get out and about, join a walking group when lockdown's over. So we're dealing with that, and then there's obviously the contract management side of it, for the services that we commission. On top of that, we'll be starting other various groups, such as Best Start, which looks at child health in the first 1,001 days of a child's life to make it the very best we can, and to help the child reach its full potential. So it's a very mixed bag.
Yeah, it's very varied, isn't it?
Yeah, and there's Public Health England, which is a large organisation, there's the Department of Health, and there's Leeds City Council Public Health, and we are all interconnected, so we're all part of the same system. And there's Clinical Commissioning Group, the NHS, our volunteers, Forum Central. I mean, I have to say, workers like yourself, managers, volunteers, have really helped lift Leeds out of COVID-19 and help to keep the infection rates low. And we're definitely going in a lot of work still to do, but we're definitely going in the right direction.
Thank you very much on that.